Welcome. I'm Donna, a physical therapist assistant from the Southern Arizona VA healthcare system. I'm here to continue our pre-operative education seminar for total hip and total knee joint replacement. We're going to talk today about the importance of exercise before your surgery to help you have the best outcome possible after your surgery. You're going to need a few items before we get started. One of them will be a chair without wheels. Another one will be a belt or a strap. You'll also want to have a firm mattress to lay on, or an exercise or a yoga mat, and comfortable clothing so that you can move around safely in. You're going to want to do these exercises twice a day. The repetitions are normally 10 to 15 reps each time you do them. If you have any pain with these exercises, please stop and discontinue that exercise. Maybe try it a little bit later in the day with fewer repetitions or a lesser range of motion. Thank you. Let's get started. I'm going to demonstrate about 3 repetitions of each of the following exercises, but when you're doing them on your own, you're going to want to do 10 to 15 reps of each exercise twice a day unless otherwise stated. The first exercise that you're going to work on is called ankle pumps. You can extend one leg at a time, or you may extend 2 legs at a time. You're going to push your feet up and down 10 to 15 times. This will help to circulate blood and reduce your risk of getting a blood clot. The second exercise is going to be called the long arc quad. You're going to sit upright in your chair. You're going to extend one knee out. You're going to count to 5, so it's 1, 2, 3, 4, 5, and then you can bend the knee and relax. This exercise strengthens your quadricep muscles, which are going to help you when you're standing. You're going to do it again. Every time you do it, you're going to hold for 5, hold, 2, 3, 4, 5, bend it back, and again, hold, 2, 3, 4, 5. You're going to do all 10 to 15 repetitions on one leg, and then you'll switch and do the other leg. This next exercise is called an armchair push-up, and you're going to want to use a chair that does not have wheels on it, with your feet flat on the floor, your arms on the armrest, and you're going to press up with your arms and then lower down slowly. You're going to do that again 10 to 15 times, and I'm just going to show you a few reps here. So you're going to press up and lower down. And again, it's pressing up and lowering down. And this is going to strengthen your tricep muscles, which is going to help you push up when you're getting up out of bed or out of a chair. The next exercise is called a seated hamstring stretch. You can do this sitting on the edge of your bed if you would like, or again, you can do it on a chair without wheels. You're going to extend one leg forward with your knee straight, your toes pointed up toward the ceiling. You can put one hand on that thigh if you're more comfortable, and you're going to lean in, keeping your chest straight until you feel a pull in the back of your thigh. You want to breathe steadily and count for 15 seconds to hold. So you'll hold the entire 15 seconds while you're counting. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and then you sit back up and you can bend that knee. You're going to repeat that stretch on the same leg. Again, lean in, trying to keep your chest up, and you're going to hold again for that 15 seconds, counting out loud while you're doing it. When you're done with that 15-second hold, you lean back, and you're going to repeat this whole sequence 5 times, okay? There should not be pain with it. You should just feel some stretch on the back of your thigh. And again, you're going to lean in, keep your chest up, and hold that position for 15 seconds. When you've completed stretching the right leg, then you're going to turn around and do the exact same thing on the left leg. Okay. All right, so that is it for our seated exercises. And follow me, and we're going to go to the exercises where you're laying down.